All right, eating disorders and body image disorders are not just a problem with women. Men and children are also dealing with this. In fact, according to the Academy of Pediatrics, hospitalizations of eating disorders of kids ages 12 and younger rose by 119%. Check out that number, 119% from 1999 to 2006. So as a parent, what do you need to know? Dr. Jeff Daly is here to break this all down for us. Thanks for coming in. We do appreciate it.
Good morning.
That number is shocking, startling.
It really is, and the question becomes why this sudden rise over a short period of time, and part of what we're looking at are the influences and the pressures, Heather, that the children are facing from not only a peer influence that's of course fueled by social media, but the pressures of sports. I mean, kids that are involved in sports have a really such a strong pressure to perform and to look a certain way, and that of course leads into college and professional, and so they start looking ahead and they get very obsessed with their body and how they look. And also, let's look at the media. The media has such an influence and unintentionally creates body image problems. I mean, look at magazines, look at commercials. They're really dictating what's attractive, what is preferred, and if you look like this, then good things will happen. Now, when these pressures are compounded together, this is part of what's fueling this rise, this increase in children who are not only suffering from body image issues, but full-blown eating disorders and subsequently being placed in a hospital for treatment.
And we're not just talking about young girls here. I mean, when you mentioned athletes, there's a lot of boys in that category too.
When you typically think of eating disorders, usually you conjure up a female of a certain age, usually 18, and that's statistically when eating disorders start. But what we're seeing now, and we've seen it for actually many years, men and children are suffering as well. Unfortunately, research and attention, in terms of media attention and research attention, is not paying enough attention and not funding enough research, because that's part of why we have a rise. And if we don't start paying attention to early detection with these special populations, we're going to continue to see this rise.
Okay, let's also talk about warning signs for parents out there. There are two different types of warning signs. Early warning signs that your child may be headed toward this type of behavior, and then later warning signs, which can be a lot more serious. Right,
and the later are of course more serious, so you want to catch it early on. Just with any mental or physical issue, the earlier the better. If you notice bizarre or erratic behavior around dinner time or any eating, that's a warning sign. So is there a refusal to eat around family members? Does the person eat, your child eat, and then beeline to the bathroom or engage in some kind of compensatory behavior like excessive exercising or use of laxatives? It sounds subtle, but again, these are early warning signs. Now the later warning signs are the dentist will say, why do you not have enough enamel on your teeth? Or the doctor will say your labs are off, or you should have had menstruation now and you haven't. So these are more serious warning signs. By that time, usually the child is in a significant distress and needs to be hospitalized. So you want to catch it early on so parents can pay attention to behavior around food and surrounding food, not only what they're talking about, such as, you know, my friends are eating like this, or maybe they're being obsessive about what they eat, but also their exact behavior. And look at how they eat food. Do they have any compulsion surrounding food? Do they not eat certain foods? Do they put food off the plate? Those are potential warning signs as well.
Now we're flat out of time, Dr. Daly, but we were chatting during the commercial break and you had mentioned that this is not a problem parents you can deal with on your own. You have to get a specialized doctor involved. So don't think just you as a family unit can come together and get this solved. That's just not the case.
That's right. Parents are great at recognizing the symptoms. If you know the warning signs, that should lead you directly to a professional who specializes in ED that has the best prognosis.
All right, Dr. Daly, thanks so much for coming in. We certainly appreciate your expertise on this topic. We're taking a short break and we're back after this.